Good morning, and welcome to the Healthcare Accountability Ordinance Minimum Standards Review. This is brought to you by a presentation from the San Francisco Department of Public Health and also co-presented by the Office of Labor Standards Enforcement. A little bit about this particular presentation. This webinar is being recorded, and the slides and the recordings will be posted on the Healthcare Accountability Ordinance webpage at the link provided on the slide. Questions and answers. To ask your questions, please do so through the questions and answers box during the presentation. At the very end of the presentation, select questions will be answered live. And if your question isn't answered live, you will receive an email response at the email address you used at the time of the registration. So please note that sometimes questions may require more information and you may be asked to contact us. So we have a lot of staff here today. We have Max Gara from the Department of Public Health, and he will be your presenter today. We also have Jade San Diego from the Office of Labor Standards Enforcement. She is in the chat box and providing information for us. Good morning, Jade.
Hello, good morning.
And my name is Beverly Popek. I'm with the Office of Labor Standards Enforcement. So it is my pleasure to introduce Max Gara. And Max, take it away.
Thank you, Beverly. Good morning, everyone. Again, my name is Max Gara, and I work with the Department of Public Health in San Francisco in the Office of Policy and Planning. So as Beverly mentioned, this presentation will be reviewing changes to the minimum standards that are going into effect at the start of 2023. This presentation is geared towards insurance brokers and folks who work with insurance. So with that, I'm going to give an overview of the HCAO. So enacted in 2001, the Healthcare Accountability Ordinance, or HCAO, represents one of San Francisco's early pioneering efforts to reduce the number of uninsured in San Francisco. The purpose of the HCAO is to increase the number of San Francisco workers who have access to affordable health insurance. The law requires that employers with a contract with San Francisco or lease San Francisco properties provide a health insurance plan that meets a set of minimum standards. The employer pays a fee when they choose not to offer a compliant health plan. The fee is intended to cover the cost of healthcare provided to those uninsured employees who may seek healthcare services within the San Francisco Health Network. A health plan that is offered must meet all minimum standards to be considered compliant with the HCAO. The law requires that the standards be reviewed every 2 years, and the Department of Public Health forms a work group that reviews these standards and proposes recommendations on their revision. The Health Commission has a sole authority to revise the standards. The standards were recently revised at the end of July of this year, and the revisions will be going into effect starting January 2023. So one point of clarification I do want to note is that the HCAO is distinct from the Healthy Airport Ordinance, or HAO. Under the HAO, employers at SFO with employees covered under the SFO Quality Standards Program, or QSP, are required to meet health coverage related requirements that are distinct from the HCAO. If you have any questions about what those standards are, or whether your employers are covered under, or your employees are covered under SFO's QSP program, you can contact the program directly. And I've provided the contact information at the bottom of this slide, and it's also available on the government website. Beverly, next slide, please. So before diving into the updated minimum standards, I want to discuss the relationship that the Office of Labor Standards Enforcement, or OLSE, and DPH each have with enforcing the HCAO, and how you might interact with the agencies regarding your compliance with the law. As the diagram shows, DPH facilitates the process to update the minimum standards and review health plans for compliance. OLSE is more focused on enforcement and engages in actions like responding to worker complaints and auditing employers. If you need a review of current or potential plans to ensure they comply with the minimum standards, you can send them to me as DPH's representative. I'll have my information listed at the end of these slides. Next slide, please. So let's move on to the minimum standards. Plans only need to cover individual medical coverage for the employee only. The standards do not apply to vision or dental services. There are 16 standards, and overall, standards break down into 3 types. Premium contributions, which must be fully paid by the employer. Cost sharing, which includes out-of-pocket expenses, deductibles, copays, and coinsurance. And required covered services, which aligns with the essential health benefit categories. So before diving into more detail into these standards, I do want to preface that if you're working with an insurance broker, you can have them send plans to us or to myself to review to see if they comply with the minimum standards. Next slide, please. So at this time, I'd like to review in detail the minimum standards that will be going into effect January 1st, 2023, and how they differ from the current standards. Note that if your health insurance policy does not end until after the revised minimum standards become effective in 2023, it will not be considered out of compliance. Only the subsequent plan with an effective date on or January 1st needs to comply with the revised standards. So under the standards, as is currently the case, all gold and platinum plans are automatically deemed compliant if the employer covers 100% of both the plan premium and medical services deductible, and the plan covers all required covered service standards. These are standards, minimum standards number 5 and 8 through 16. If your plan is not gold or platinum, then it must follow and adhere to all 16 minimum standards, which I'm going to go through now. Next slide, please. For standard 1, there are no changes, and employers must still pay 100% of the plan premium. One of the most significant changes to the minimum standards is to the out-of-pocket maximum. Under the standard, employers must cover employee in-network out-of-pocket medical expenses up to 50% of the plan's out-of-pocket maximum. So, for example, if the plan's out-of-pocket maximum is $8,000 for in-network expenses, then the employer must cover the initial $4,000 of expenses that count towards the out-of-pocket maximum. These expenses must be covered on a first dollar basis, and all types of cost sharing, including deductibles, copays, and coinsurance, must be counted towards the out-of-pocket max. Employers may use a third-party administrator or other appropriate option to manage reimbursement of employees' medical expenditures that count towards the out-of-pocket maximum, as long as employees' protected health information remain private and confidential in accordance with state and federal laws. Reimbursement options can include using an HRA or HSA, and there's no need to pre-fund the required amount. And while not required, employers are strongly encouraged to provide an employer-funded mechanism, such as a pre-funded debit card to beneficiaries to cover out-of-pocket expenses upfront, such as copays. Lastly, out-of-pocket maximums will remain synced to the patient-centered design out-of-pocket limit, which in 2023 is $8,750. So again, a plan's out-of-pocket maximum cannot exceed $8,750 in 2023. As a result of these changes, the cost-sharing minimum standards for coinsurance and co-payments have been revised to allow for greater availability of compliant plans on the market. And I'll talk about this in more depth in a moment. Next slide, please. For the standard on the medical services deductible, the requirement that employers fully cover the deductible has been removed. Note that the deductible limit will remain set to $3,000. And for platinum and gold plans to be automatically compliant, employers must still fully cover the deductible, as I mentioned earlier. Under standard 4, plans must provide drug coverage including coverage of brand name drugs. And if a prescription drug deductible is required, it cannot exceed $300 for in-network drugs. Next slide, please. So again, given the changes to the out-of-pocket standard, the cost-sharing limits for coinsurance and primary care copayments have been adjusted, thereby increasing the availability of plans for employers to choose from to comply with the HCAO minimum standards. So if a coinsurance is required for any service, they cannot exceed the following breakdowns. For in-network services, 60%, no more or no less than 60% must be covered by the health plan, and no more than 40% must be covered by the employee, which is different from the previous standard where 80% was covered by the plans and 20% or no more than 20% could be covered by the employee. For out-of-network services, there continues to be a split, an even split between the plan and employee. For primary care visits, they must be covered, and if a co-payment is required, then in-network costs cannot exceed $60 per visit, and this is up from $50 per visit. If coinsurance is provided instead, then it cannot be greater than the coinsurance standard that I just went through. Next slide, please. For the rest of the standards, there are no changes, but I'll go through and review them. Preventative and wellness services must be provided at no cost per, and this is in following with the ACA rules. For pre and postnatal care, scheduled prenatal exams and first postpartum follow-up consults must be covered without charge. And this is again in following with ACA rules. Next slide, please. Plans must cover ambulatory patient services, and the coinsurance requirements I just mentioned apply. And if there are co-payments, they must not exceed limits related to the primary care provider visit requirements I just went through. Hospitalization services must be covered, and if coinsurance is applied, it must follow the coinsurance. Again, it must follow the coinsurance breakdowns I've described. Next slide, please. So plans must cover ambulatory patient services. I'm sorry, I just went through that. Again, plans must provide behavioral health services, rehabilitative and habilitative services, and laboratory services. No co-payments are required or specified, but the same coinsurance requirements that I've gone through do apply. Next slide. So the last standard requires, standard 16 requires that plans cover all benefits listed in the California benchmark plan. This standard is especially pertinent to employers based outside of California. Other states may not require coverage of services that are required in California. And these services can include bariatric surgery, acupuncture, and weight loss. It's not uncommon for out-of-state employer plans to be deemed non-compliant as a result of not covering these services, even if their cost-sharing elements are compliant. Next slide, please. So please remember that compliance is all or nothing. An employer plan is compliant with the minimum standards if it satisfies all 16 minimum standards, or if it's a gold or platinum plan where the employer covers 100% of both the plan premium and medical services deductible, and the plan covers all required coverage services. And again, these are standards 5 and 8 through 16. Next slide, please. So so we now have plenty of time for questions. And again, if you have questions later on after this presentation, please feel free to reach out to me directly based on the contact information on that slide. I'm going to hand it off to Beverly, who's going to provide a little bit more information on the logistics.
So now we're at our question and answer session. Please ask your questions via the question and answer box, and we will answer questions live. And if your question is not selected live, you will receive an email response at the email address you used at the time of registration. Now, some questions may require some more information, so you may be asked to contact us. So thanks, Max. We have a lot of questions here. And one of the first questions that I see is, does the HCAO require that coverage be offered for the individual employee and their dependents?
Thank you, Beverly. No, the HCAO only requires that the medical insurance be offered to the individual worker.
Okay, thank you for that. This other question has to do about offering plans and I guess a compliant plan. So this is what this employer wrote. Has to offer one compliant plan. Additional plans have to follow the same rules.
Yeah, we get this question a lot. So a covered employer is only required to offer one compliant plan, and this has to be at no charge to the employee. If they do choose to offer additional plans, these plans do not need to meet all the minimum standards, and they can be administered as the employer chooses. So this means, for example, after offering a compliant plan at no charge, the employer can also offer a plan with different benefits that do not meet the minimum standards, or they can offer a plan that requires an employee pay a premium contribution.
Hey, thanks, Max. This next question has to do about, I guess, which minimum standards to use right now, because we're still in 2022. And the current standards, I guess, are valid until December 31st of 2022. And now we've just released the new minimum standards, which will be effective for January 1st, 2023. So this employer writes, if our health insurance policy does not end until after the revised minimum standards become effective for 2023, will we be considered out of compliance?
Yeah, so if an employer's plan year that overlaps with the revised standards that become effective in January 1st, 2023, they're still under the standards effective January 1st, 2022. Only any subsequent contract that's effective on or after January 1st, 2023 will need to comply with the revised standards.
Great. Now, this is a question about the differences between the two different laws of healthcare accountability ordinance and healthy airport ordinance. Um, how do I know if I have to comply with the healthcare accountability ordinance, HCAO, or the healthy airport ordinance, which is called HAO?
Yeah, so again, the HAO applies to employers at SFO who have employees that are covered under SFO's Quality Standards Program. And if you have any questions or if you want clarification whether your employees fall under this program, you can reach out directly to SFO's QSP program. And I believe that information or contact information was provided on the slides, but you can reach out to their email at qsp@flysfo.com. And I do want to note that, again, the requirements under the HCAO and HAO for health coverage are distinct from one another.
Totally. I'd just like to follow up that if you are interested in the Healthy Airport Ordinance, HAO, there is a separate web page and information about the standards and the plan there. So feel free to look for that information on the OLSC website, or just contact OLSC and Max and we can always assist you in guiding you to the right information. The next question has to do about pediatric vision and dental coverage. I think that's part of number 16. The question is, do we have to offer pediatric vision and dental coverage as part of the healthcare accountability ordinance requirement?
Yeah, so this is something that even though it's in the benchmark plan, it's not something that we expect because the HCAO predominantly or pretty much 100% is just for adult coverage. It's not meant for and employees dependent, so i.e. their kids. And so we do not expect plans to cover pediatric vision or pediatric dental coverage.
Okay, thank you. The next question is about health plans written out of state. How can we comply with the coverage requirements under Standard 16?
I highly recommend working with a broker and also for services that aren't covered in the plan that are under the benchmark. I recommend getting a rider for these services. Or if that's too difficult, then to just go directly to get a plan written in California that is required to comply with all benchmark standards.
Great. This question has to do about self-funded and fully funded plans. Does it matter if our plan is self-funded versus fully funded as it relates to the HCO minimum standards?
No, it doesn't. Plans can either be fully funded or self-funded as long as they comply with the minimum standards. It does not matter.
Oh, that's great. Well, Max, I think there are a few more questions that are there that may require some more information, and we'll be able to reach out to folks after. But take a look at some of the questions and see if there's anything else you'd like to add before we close.
Yeah, so there's a question regarding the new or the revision to the out-of-pocket maximum standard on what is meant by first dollar coverage. So again, say for example, a health plan's out-of-pocket maximum is $8,000. The employer must cover 50% of those out-of-pocket expenses on a first dollar basis. So they would have to cover the first $4,000 of expenses that count towards the out-of-pocket maximum. They couldn't split between the employee those first dollar charges. So there's a question, employers are no longer required to cover the full cost of the deductible. Is that correct? So again, as I mentioned, there's two pathways to complying with the minimum standards. The first is to if you're offering a gold or platinum plan, then your plan would be automatically compliant if the plan or the employer covers 100% of the plan premium and 100% of the medical deductible. But if the plan isn't gold or platinum, then it needs to cover all 16 minimum standards, and the medical deductible standard no longer needs to be covered. But I will just note that given how the out-of-pocket maximum standard is written, that in pretty much all cases of plans, the deductible needs to count to the out-of-pocket maximum, and most deductibles their amount is less than half of a plan's out-of-pocket maximum. So let me just give an example. Say again, your out-of-pocket maximum is $8,000. You need to cover again 50% of that on a first dollar basis. So in this case, $4,000. And if you have the plan's medical deductible is say $2,000, that medical deductible needs to count towards the out-of-pocket maximum. So effectively, you will still be covering the full cost of the deductible. I'm going through and just seeing if there's any other questions I can answer now. Maybe this is a, hold on one second.
Oh, there is something I'd like to add while you're looking, Max.
Yeah.
If you're here to understand the standards, the intricacies of the insurance requirements for the HCAO, you're in the right place. But I do see some questions that would cross over to eligibility of who's a covered employee. So what I would say is that it, you need to review the requirements of who is eligible and who is a covered employee under the Healthcare Accountability Ordinance. And a covered employee is someone who's working 20 hours per week for a covered employer. And the coverage, if the employer is planning to comply with this law by offering health insurance, the health insurance needs to be effective by within a month. So I would strongly recommend that anyone who's interested in understanding the nuts and bolts of eligibility and the different options, it's great that you're here about the insurance stuff, but there's a lot more to review. Please go to the Office of Labor Standards Enforcement website, and we do have video on demands where you can review the Healthcare Accountability Ordinance and provide some basic information of compliance and options. And there are some questions which I think OLSC will respond to via email at a later date, Max, regarding this particular item.
Great. Thank you, Beverly. I think I've reviewed the questions. I think there's maybe one or two that I'll have to follow up offline for more information. But otherwise, I think we're good for now. But I do want to reiterate that if folks have any questions regarding whether or not their plan complies with the minimum standards, please don't hesitate to reach out to me. I'm more than happy to kind of try and clarify how the standards apply or how the plan complies or doesn't comply with the standards. Thank you for your time, everyone.
Thank you so much, and we will certainly email you if there was a question asked and we were not able to answer it live. Thanks again. Take care.